practitioner in immunology and allergy. I've been working with the PI community for probably the last 18 years.
Great, thank you both. And Alexandra, would you like to use the podium?
Okay. All right, so I'm Dr. Alexandra Matthews, and I'm going to be talking about parenting teens and young adults with primary immune deficiency. And there's a little bit of information about me. I'm on the clinical faculty at UCSF, San Francisco, and I also have a teenage daughter who has had PI since she was really an infant, and I actually, in the process of getting her diagnosed, figured out that I also have a PI, which would have been lovely to know back when I was younger. So what I'm going to do is I'm going to, in my private practice, I do a lot of work with parenting, and I work with a lot of folks who have various kinds of chronic and life-threatening illness. And so the reason that I'm interested in this topic is because I've seen, I've worked in therapy with these folks, and when people come into therapy, when parents bring their kids into therapy, it turns out the medical problem actually turns out to be minor compared to the sort of behavioral issues that the kids have as a result of extremely well-meaning parents parenting very intentionally in a way that they think is best for their kids, and actually it turns out to be a disaster. So, and we see a lot of times almost all the issues resolve once the parents kind of clean up their parenting. So what I'm going to do is give you kind of a general, rather than a list of like little how-tos, I'm going to just give you talk about a general model of parenting that my clients find really helpful, because when you're struggling with your kid, you can kind of think about, well, am I in one of the wrong boxes on this chart? So we've been trying to figure out, literally for thousands of years, people have been trying to figure out how to parent effectively. They found a stone tablet from ancient Roman times that a father had chiseled in stone how rotten his kid was and what a good dad he was, and had dragged this huge tablet out to the town square. So we know people have been thinking about it for that long. And then about 100 years ago, psychologists started to think about, we have some parents are more warm and some parents are more controlling, and which of those groups of kids does better? And what they were finding was that there wasn't a big difference between the two groups overall. But then in the 1950s, a psychologist named Diana Baumrind realized that if we cross these dimensions of warmth and control, and we can kind of categorize parents by, all parents are high or low on warmth, and they're high or low on control. And so when you cross those dimensions, you get these, very different boxes. So, and I'll just cut to the chase for you guys, which is that the kids of high warmth and high control parents, so up in this box here, so we've got warm, nurturing parents, but they also have, expectations and limits and consequences, and the governmental equivalent would be democracy. I have a lot of parents in my practice who, when I go through this, they say, oh, yeah, that's me. And then I say, well, okay, but just remember that in a democracy, we have an army and a police force, and we will use them. So they realize then, oh, actually, they're down in the permissive box down there. So the children of authoritative parents have across the board the best outcomes. They have highest educational attainment. They do best in work. They do best in relationships. Just across the board, they thrive. The next group of kids is the parents actually of the authoritarian parents. So these parents they can be very low warmth and very controlling. But so their government equivalent there is dictatorship. Their kids actually turn out almost as well as the kids of authoritative parents, but the one place where they're not quite as good is taking over the reins of authority. But overall, they have excellent outcomes. Interestingly, the next group is actually the kids of neglectful parents. So these kids, the parents are completely checked out, but kids are like heat-seeking missiles for authoritative adults. So what they do is they find a neighbor, an aunt, a coach, somebody who will fill that role for them. And so they actually, again, have pretty good outcomes. By far the worst outcomes are for the kids of permissive parents. We have these very warm, loving, nurturing parents who, again, are intentionally trying to be loving and caring to their kids because they think that's what will be good for their outcome, but they are a disaster. They are most likely to drop out of school. They cannot keep a job. They cannot keep a relationship, because they're not being taught the really important skills of impulse control, regulating your emotions, getting along with others, dealing with things when they don't go so well. You just have to, basically suck it up and move on. So again, most of the parents who come in to me for parenting issues are in the permissive box, and so what I work on with them is helping them to become more authoritative. So it's well known in the medical community. There's actually a sizable literature about the fact that kids with chronic and or life-threatening medical problems also have a lot of emotional and behavioral problems. I had a call a couple years ago from a physician whose child had just been diagnosed with a genetic condition that was going to be progressive and disabling. He wasn't worried about that. What he was worried about was that his child was going to turn into, quote, a monster, because he had seen that in his pediatric rotation, and he was thinking that just came along with being a sick kid. And he was extremely relieved when I explained to him that if he kept up his authoritative parenting as he had been doing, then his child would be fine, but come back and see me anytime. And I haven't heard from him since, so things are going fine apparently. So, and obviously for, with parenting sick children, there's a really strong pull. We feel sorry for them. We and the doctors are subjecting them to painful medical procedures and all kinds of unpleasant stuff. So we kind of want to make it up to them by being really warm and nurturing and just warm and fuzzy with them. But it's super important that we maintain our strong selves and have expectations, set limits, have consequences, and give kids the message that it may be, sure, you're having a hard time, but that doesn't give you the right to take out your upset on everybody around you. So, okay, so then the next I'm going to just jump to a model of development, and again, for you guys to just have this kind of concept in your back pocket. So this is a model that was developed by a psychologist named Erickson, who lived he was born in 1902 and died in 1994. And he was one of the early psychologists to realize that children weren't just miniature adults. They are developing, growing human beings, and they go through stages of development. And he talked about how at each stage of development, there's kind of a important task that we hope the child will accomplish. And so you can look at these outcomes and think about how kind of threatened and compromised they might be when you have a child who is sick. So in infancy, we want infants to develop a sense of basic trust in the world. But if you've got a child who's sick all the time and they feel lousy, they're being subjected to painful medical procedures, it's kind of a challenge, much more than if your child's healthy. And Erickson talked about how the stages, they need to go in order basically, but the ages can vary. And, but it is it's hard to build, it's kind of like trying to build a house on a shaky foundation if the child isn't able to accomplish the things early on. So, and then when kids are supposed to be developing autonomy and initiative and a sense of industry, if we have to not let them have play dates because their playmate has a cold, but our child will end up in the hospital with pneumonia, that's sort of like bubble syndrome that a lot of these kids can fall into. It can really compromise those stages of development. But what I want to, because this is a talk about adolescents and young adults, I'm going to focus a little bit on that, which is that the task of for adolescents is to develop a sense of identity and a sense of independence, and the big hazard with kids with chronic and life-threatening illness developing a sense of identity is that we do not want them to develop their identity as I am the sick kid, because that's just it's not a healthy identity to have. So helping them to develop an identity outside of that, but then we also the pendulum can swing too far the other direction, which is kids who try to pretend that they're not sick, and then they don't comply with medical recommendations. And for example, this is a huge problem with kids with diabetes, because they chronically they want to act just like all of their peers, so they eat whatever they want, they don't monitor their glucose, they don't take their insulin, and they can get themselves into a lot of trouble that way. So so the trick for us parents is to think about how can we help our kids develop a sense of identity that isn't wrapped around illness, but also give them a way to honor to deal with their illness in some way, which is why conferences like this are great and retreats are fantastic, because it gives those kids a space where they can be sick, where people can understand. One of the also major issue with kids with PI is that they have what's called an invisible disability. And there's a large literature showing that kids with visible disabilities, so cerebral palsy or something, they're in a wheelchair, whatever it is, something that's clearly visible to the eye, those kids actually have better mental health than kids with invisible disabilities like asthma, diabetes, and PI. Because if you have cerebral palsy and for example, you're not doing PE with the rest of the kids, everybody understands that. But if you've got a PI and you're not doing PE, or you keep missing, you miss a day of school every month and people are wondering what's going on with you, it's hard to explain. And especially something like PI, that's really hard to explain because nobody else has ever heard of it. And then also kids have to worry about, they just have to deal with things that other kids don't have to deal with. So my daughter, we're looking at colleges for her right now. Well, in addition to what college would you like to go to and can we afford the tuition, we have to think about insurance. And will she be able to get the treatment that she needs wherever she wants to go to college? So it sometimes means we're having to lop off some colleges from her list. And again, these are not things that other kids have to deal with. So in a lot of ways, kids with PI have to grow up prematurely, but in some other ways, they're a little bit delayed, because in those earlier, the sort of childhood stages where they're developing a sense of autonomy, initiative, and industry, they don't get to have that a lot of times because they have to go in for their treatments. They can't go be around sick kids, those kinds of things, and so they're not allowed to express themselves through those stages. So we get some, developmental delays. Okay, and I'm going to stop there and let my colleague speak. Giving a parenting talk at a school, and actually the principal of the school who'd invited me summarized it, and he said, "So look, you guys, it's better to beat your children than to be too nice to them." So he was joking, but
It's better to beat your children than be beaten by your children.
yes, actually.
All right, and William?
Hi, thank you, Alexandra. I really appreciate your talk. These are my disclosures. I'm now the chairperson of the IDF's Nurse Advisory Committee, and I do some consultation for CSL Behring, who has been very helpful to all of us in this community. What we want to try and get at today is to give you some kind of information about how to support and empower your teens and young adults. And excuse me if through the course of this I sort of interchange things and call them kids or children, but it's just sort of, it's just for facility in talking. But we want them to be able to live their life to the fullest and to be able to ultimately manage their own care. You know, when you have a child, they don't come with a little instruction booklet attached to the umbilical cord. You know, I mean, all of us in our jobs, we go through orientation and training, and guess what? When you become a parent, there's little or no instruction or training that comes along with it. There are a lot of challenges just being a parent, and when you've got a kid with a primary immune deficiency or any kind of other chronic disease, you have additional issues that you have to manage that go over and above the ordinary things that come along with having children, because we want them ultimately to be able to succeed and become healthy as they journey on to become adults. When you've got a child and you find out that they have PI, do you really want them to live in a bubble, to be completely protected and isolated? I mean, clearly as a parent you want your kids to be protected and safe, but do you really want them to live in a bubble completely separated from the rest of the world? Or do you want them to be able to climb to the highest heights that they can possibly reach and attain all the successes that are possible to achieve in your life, in career, and in all the multiple dimensions that we have available to us? And I think the answer to that would probably be yes. We want them not to live in a bubble, and we want them to achieve. To get this done, it's not always a picnic if you're a parent. For our kids, life is about being young and crazy, about taking chances, having wild nights, making the most of what's around you, and spending time with your friends. And that is, driven by the same developmental forces that Dr. Matthews was talking about. This is part of the normal process in life. And when you've sort of thrown PI into the mix, you have additional forces that you really have to take into an account. And it makes you, as a parent, a zebra because your hair goes very quickly gray. So what are we going to do to help our kids out? Well, there's a lot of things they need to know how to do when they've got PI. And the responsibility of a parent is to try and provide the kids with some of that know-how. They have to be able to have a dialogue with their family, their parents, their brothers, their sisters, also with their friends, and ultimately with their coworkers. They need to be able to develop strategies to educate their peers about what's going on with them so that they can interact with these very important people. They have to be able to coordinate their school and their work life around the demands that we as healthcare providers put on them and that their disease puts on them. That may mean missing school because of appointments, being absent more often than other folks, depending on your particular diagnosis and the requirements of your particular treatment regimen. And they also have to be able to explore their own talents, develop their interests. They have to be able to participate in school and social activities. They have to learn how to maintain balance in life, and certainly as they get older, there are going to be issues of dating, sexuality, marriage, family, intimacy, all of the normal and ordinary things that we are developmentally driven to do are things that our kids are going to have to be able to figure out a strategy to do within the confines of the limits of their disease. And as a parent, that's part of the challenge and sort of the things that we have to help them with. So it really is a very delicate balancing act between family and career, friends and health that the kids have to be able to manage. Really, it's about control. There's a lot of things that kids are going to have to learn how to control in the course of their life. And as a parent, the challenge as a parent is going to be to help the kids to gain control. Initially, they may say, well, that's what mom's for. Why should I have to take over control? Mom takes control. The doctor is always talking to mom, so I can just, sit there with my phone and leave it all to the folks. But really, the kids are going to have to learn that there are some things that are in their control and some things that are not. The diagnosis that they're born with, it's not in their control. Their ability to influence their family and friends through education and training is something that is in their control. They've got choices to make in life about how they're going to manage their diagnosis, whether they're going to adhere to treatment. Those are things that are in their control that they're going to have to learn. They're going to have to choose to take steps to be healthy and be informed. They're going to have to learn how to maintain insurance. They're going to have to learn how to engage their peers in the whole process. They're going to have to learn how to talk to providers. As parents, we're going to have to provide them with opportunities to gain control, to give them choice, and to be able to balance their life and their career interests. So it is a developmental process. As a parent, we need to remember to always include the child in the process, particularly when you're interfacing with the healthcare system. They have to develop some kind of comfort in being able to talk to the people that are their healthcare providers. It's got to be age appropriate, but they should be able to talk to them, tell them about what's going on. If asked a question, not just sit there and kind of look over at mom as if you have no tongue and it's her job to talk, because each opportunity that we give them as a parent is something that will become the basis to build on the next level. And for them to be able to develop trust with their healthcare provider helps them to sort of move up that Ericksonian developmental ladder that Dr. Matthews was talking about. They need to learn that there are certain things that, again, are out of their control. They're born with PI. There's nothing that they can do about it. That there are certain things that are in their control, as we said, that is how they manage their PI. And they need to be able to develop the ability to participate in their own health care and become experts. They really have to become expert patients. So, this is pulled from other parts in the I guess, psychological or general just mindset of people. We have to teach our kids to control the things that they can control, to let go of the things that they can't control, and help them to develop the wisdom to know the difference between the two. And this really needs to be a mantra that we instill in our kids from very early on. Let's talk a little bit about appointments. We need to teach our kids to be able to come to a visit with questions. We, in the beginning, become the example ourselves. You ask your questions at the beginning of a visit, not at the end, particularly in the way that the healthcare system is running right now. Healthcare providers have a very limited amount of time. You may feel like you're being treated on an assembly line, and that's unfortunate, but that's nature of the system right now that's driven by RVUs and other ways to generate revenue. So you keep and teach your kids to keep a list either on paper or in your cell phone of what their questions are. Have them written down. Know to talk about any hospitalizations, emergency room visits, any infections and things that have happened to you in the interim, because those are questions that are always going to be asked every time that they go to a visit. If they've developed a strange rash or other symptoms along the line, if you've got a camera phone, you take a picture, you bring it along. You don't go in and say, well, yeah, he had this rash, and I don't know what it was. And you're going to be asked, or the kid's going to be asked, well, what was it? And because, you know, the person that you're going to be interfacing with is not going to be able to, you know, play the great Karnak and read it all psychically. We need to teach our kids to that they need to ask questions, and when they ask a question, they need to get an answer that they understand, and if they don't understand, we need to teach them to say that they don't understand. We need to let them know that when they go in to see their healthcare provider, that they can question, and that they should question, and that they need to have a discussion that's an ongoing discussion with the person that they're developing a sense of trust in as a provider, and then ultimately come away with some kind of a list of the important points and recommendations. Nowadays, with electronic medical records, usually you're given something that's supposed to be meaningful use at the end of a visit that might have a summary of it, but certainly if you're going in and taking notes, come away with a list of recommendations. Because once your kids start going by themselves, they may come out and say that, you know, I don't know what he said. For appointments, as a parent and certainly as a healthcare provider, you need to realize you need to be comfortable in the hot seat. That questions about sex, drugs, lifestyle are certainly not out of bounds. We need to be open to those. If you want your teenagers, as they're going on to explore and ultimately get into trouble, you want them to be able to ask you questions about lifestyle, and you need to be there as a resource, not a judge. You know, if you're not comfortable dealing with thinking about your kid in that particular situation, you go through things in a what-if scenario. You know, what if somebody who had an illness didn't take their medications? What if somebody who was prone to infections had unprotected sex? What do you think would happen? So you can sort of pull yourself back and use a scenario that doesn't directly involve you. You know, the old story of, oh yeah, well, I got a friend who, you know, when you're referencing yourself. And remember that you have to be honest. If you're developing a relationship that's built on trust, you have to be honest, because if you're not honest, then you're not going to have trust. And then everything else is going to just fall, as Dr. Matthews said, sort of like a house of cards. But don't sugarcoat reality. Be honest and be real with your kids. It's a very important aspect of being the parent in general, and certainly when you've got a kid with an immune deficiency. I say encourage noise reduction. When your kids are going for a visit or they're coming with you to a healthcare visit, turn the cell phone off. Take away the distractions. Let the cell phone be there certainly as a tool, not as a way to pull away from a visit. And when you're going, certainly when you've got teenagers, sometimes they want to bring a friend along. If the friend is coming along, make sure that the friend is coming along as a care partner and not just a visitor to sort of watch a show. By the time that your kids are about 21, depending on where you're getting care, they're going to have to leave the confines of being cared for in a pediatric facility, and they're going to have to enter into the adult world, and it's certainly a very different kind of care matrix when you're in the adult world. They're going to need to make decisions about whether they're going to have to be seen in a family practice, going to be seen by an internal medicine, are they going to be followed by an immunologist? Do they need to make connections with a gastroenterologist, pulmonologist, psychologist, whatever kind of specialist? And these are things that, as you are moving your kids along from their later school years into their teenage years, into their adult years, that you need to educate them as to who they're seeing and why they're seeing them. Because not everybody is going to be sort of a generalist. Again, it really depends on where you are. They're going to need to learn to find a clinic that's going to be located convenient to them. Are they going to be getting a place that's close to home? When they move away from home, where are they going to get care? Is their care going to be fragmented because all of their specialists are close to where you live, not to where they live? If they're going to go away to college, where are they going to get care? So you're going to have to help them make these decisions along the line. And that may certainly have impact when you're trying to make decisions about where they're going to go to school. They're going to need to learn, and we're going to have to help them learn who pays for it all. That health insurance is absolutely necessary for them because they've got a chronic illness. They need to know what the difference is between the different kind of options that are available out there, whether it's an HMO, a PPO, a POS, about the Affordable Care Act. God only knows what's going to happen with that, but they need to know the difference between health insurance premiums, co-pays, deductibles, what's a covered service, is there IVIG or their gamma globulin being paid for under the medical part of their plan? Is it covered under a different part of the benefit plan? Are they getting it as a pharmacy benefit? Where are they getting their prescription drugs? What are the differences between those kind of benefits? Because once they're sort of cut free and out in the adult world, it is something that they're going to have to be able to navigate through. You don't want them to come to a point where the end of the year comes and all of a sudden they find that they're going to have to spend a couple of months without their medications because they didn't know where they were coming and what was required to get them. And then what's going to happen to them without insurance? What medical assistance programs are going to be available for them, or are they going to have to be able to get put into a cash pay circumstance? So certainly things like most of the pharmaceutical companies will have some kind of a safety net program, and it's important to teach your kids about those programs and make sure that they do get enrolled in them and that they continue to qualify for those safety net programs in case they find themselves in a gap without an insurance. They need to stay continuously insured. This is something that our kids need to learn up front. When they're thinking about what kind of a job they're going to get into, they need to remember that they want to get one that's going to provide insurance. They should be able to stay on your plan until they're about 26. They may have to apply for medical assistance. I just put this up there because prior to there's some state-to-state variation. In some states, in Florida, you can stay on your parents' insurance up until age 30. In Illinois, New Jersey, New York, there are different state requirements for how long you can stay on your insurance. So it's important, again, to educate your kids about that, and you may need to take those things into consideration depending upon where they're going to plan on going to school. And this is, unfortunately, a very changing matrix. what kind of skills do kids need? There's a lot of stuff that we have to teach. And what this is, and this is available for you guys through the IDF, this transition skills checklist that was developed by my partner in crime, Carla Duff, and is readily available through the IDF website. And it's a transition skills checklist, and it goes through in age-specific groups, general information, things like diagnosis and history, medications and treatment, things about medications, knowing side effects, knowing the treatment plans that you have, appointments, how to provide your interim history, questions to ask, things about the healthcare system, and things about transitioning. So it's a skills checklist, and it's a kind of a useful tool as a parent, because you can take a look at where you are with your kids and see if they have the abilities, if they don't have the abilities, and if they're maybe in the process of getting them. And you can use this with each, this like 12 to 14, this is 15 to 17, and then there's an 18 and up checklist, and they sort of build on top of each other. And it's a tool to try and help, because I think when you're parenting a child who's got a primary immune deficiency or any kind of other chronic disease, we really have to help them develop skills to be an expert patient and to learn how to advocate for themselves. And it's a really complex process, and it's an ongoing developmental process. And they're not going to be able to do it without your help. We really want kids to have. We don't want our kids to be sick. When you've got somebody who's born with the disease, we need to find a way to fit that disease into their life and not have their life fit into a particular disease. So, hopefully some of the things that we talked about and some of the things that are referred to on the checklist here will give you guys a handle on some of the areas that you can work on to help your kids become successful and to become what we really want them to become, which is independent, self-fulfilled adults. Yes, yeah, I am at the end here. These are just resources from the IDF. Thank you.
Okay, we only have about 4 minutes left over before the end of the session. We will stick around afterwards while if you want to go to lunch, for any questions, so we can talk more about what your teenagers are going through and what they're feeling. One thing I do want to follow up on what William said. To me, it's not so much about control as it is about ownership. And as your teens are growing and they need to take ownership of their condition and of their treatment. And to me, ownership is the entire gamut of what they're experiencing. And it's not just about control. It's who they are. It isn't their identity, but it's part of who they are. And part of that also is for you as parents to start letting them own their condition and understanding that while you're the parent, it's their condition. And that's hard from both sides. One small part of that is as you reach out and your kid is sick or something happens to your kid, know that that's theirs. And that's not for you to be telling people about as they become teenagers. And I've talked to the kids about this, and I felt this same way as a teenager. Who finds out and who knows about their condition, at this point, that's their decision. They own that. So, as parents, you need to think about who you're talking to and who you're telling, and this is theirs now. And some of them are maybe younger, some of them may be ready to take that, some of them may not yet. But there is something they need to have, and it's their own, and they're going to carry that with them for the rest of their lives. So again, thank you very much for being here, and we will stick around for any questions if anyone wants to come up and chat with us. Thank you.